My name's April. I am a certified dental assistant and also a certified orthodontic assistant. I knew early on that I wanted to be in the dental field. I had braces as a teenager and I was always just intrigued by it and how the ladies worked and that. So it was something I always looked forward to. So when I was in high school, two of the classes that I majorly had to take that would help so that I didn't have to take them at the technical college would be advanced biology and algebra. And actually, the program is a certified program, so it's only a 1-year program, but it's the full 12 months. I actually started my 12-month educational program at NWTC 1 week after graduating from high school. So I bounced from one right into the next, and it was actually a lot easier to do it that way. But I graduated in NWTC in 2002. I did a 6 months in oral surgery, removing teeth and removing wisdom teeth and things like that, realizing real fast that that was not my field. Blood is not my forte. In the fall of 2002, I started a 12-year career with Orthodontic Specialists of Green Bay. And what we did there is we put on braces and dealt with Invisalign and different treatments of bracelets like that. And I was hooked. I loved it. Once you do your certified program, once I entered into Orthodontic Specialists of Green Bay, it was a really intense 12-week training program. There's just so much technology and so much info that comes with the orthodontic specialist, with the ortho field. And then I was there for about 12 years. I took a full year off. Excuse me. I took about a, hang on, I lost my spot. I'm sorry. Then took about, it took me about a full year to understand everything and to just get it all to be smooth and steady while I worked on everybody. Then in the fall of 2012, I stayed home. I tried to stay home with my 2 little kids. It didn't last very long, but a couple of months, and I really missed it. So now I work for Wilke Orthodontics, and I have been here for about 6.5 years. And I started out, it's a pretty nice, like I work part-time. You can get your hours in 4 days. So I work 3.5 days a week. We have 3 different offices. We have the Green Bay location, the O'Connell Falls location, and the Sturgeon Bay location. So we travel between all 3 of those locations throughout the week time. And my days are pretty busy. I can jump from several different departments. So I'm just going to flip. So one of the things that I do in Sturgeon Bay is I work at our front desk and I answer phone calls and make appointments for patients, deal with any billing that they would have questions on, any insurance. One of the other things that I do as well is I'm also a clinical technician. So this is what our clinic looks like. And we have 4 chairs that each assistant is assigned to a chair a day with a column of patients. And you are responsible for seeing those patients and those different types of appointments. It's really nice because it's not the same appointment over and over. Every appointment is different. So you could start the day with putting braces on and then next take braces off on the next patient and do an adjustment after that. So it's really nice because it's always different. Another thing that I also do is, this is our sterilizing area where we sterilize all of our instruments afterwards. So it's really nice because then I can also jump in here and keep up and help the assistants and keep everything flowing. This part gets pretty busy. Our whole day is a lot of jumble running around and just getting patients in, being seen on time, but it's fast paced and it's a fun environment to work in. I also laid out just a few of the things that we do here at Wilke Orthodontics. We do different types of braces. So these are just your traditional braces that we do. And then we also do Invisalign. So it's just a clear brace that fits over your teeth that help move your teeth. And then I also help in our lab area if needed. So these are just a few of some of the appliances that we make here in-house, because we have a lab right here in our at our main facility in Green Bay. And we go ahead and we make all of these. So we take impressions that make these stone casts, and then from there, we can build all of these appliances for patients. So it's a very nice environment. Like I said, it's very fast paced, but it's fun. You're with multiple people during the day, multiple appointments during the day. I just absolutely love it. Like I said, I've been doing it for about 18 years, and I just cannot imagine doing anything differently. It's just I mean, there's nothing bad to say about it. It's just, you're always going, you're always moving, and you're always meeting new people. So that is pretty much what I have for you that has to do with the orthodontic and end of everything.
All right. Well, you're talking about braces and impressions, and you're sending me back to 2.5 years of my life when I was in high school. So I remember getting impressions.
Well,
I don't think you ever
everybody
forget
remembers
that group that you have to use. To get
Yep. Yes, it
So
is.
one question that I have is, you are a dental assistant and an orthodontic assistant. What are other positions that are found at your particular facility?
Well, we have quite a few actually. We have the front desk ladies. We always have an insurance coordinator. We have somebody that primarily just battles with insurance all day, because ortho is a gray area when it comes into insurance plans. And then we have a financial lady who deals with all the billing, the financials, making sure that people are billed properly for their treatment and times, and then it's the right amount, also incorporating in the insurance. We also have a few TCs, which are treatment coordinators. They're the ones that when you come in and you meet with doctor, they're the ones that present your case to you. They're the ones that are going to be the one kind of selling you the braces, telling you, okay, this is how long your treatment plan is. This is what doctor has outlined for you. This is how your cost is. And this is where insurance picks up. So, I mean, we have quite a few different roles. And then we also have our lab technicians, and then again, our clinical technicians.
All right. So can you tell me the difference between a dental assistant and a dental hygienist?
Sure. A dental assistant, there's a variety of roles. Like I am in the ortho field. A dental assistant can be in the surgical field, the general dentist field. They're one that primarily assists the orthodontic, the surgeon, or the dentist. The hygienist is one, they typically clean the teeth, and they're typically off by themselves. They pretty much man their own day. But it's a different, you're dealing more with more in depth than what an assistant would. So you basically clean the teeth, and you have to, get down below the gum tissue and things like that. So you have to be more certified for a dental hygienist than an assistant.
Okay. All right. Allison, do you have questions?
I do. When you think about your 20 years, 18 years in this space, what have you seen that's changed?
I have definitely seen the way we put on braces. Doctor doesn't put the braces on individually anymore. The assistants do it themselves, and the whole appointment takes about an hour and a half, where in the past it had taken about 4 hours. The different types of braces that go on the teeth. We have new programs that now doctors don't have to bend the wires. we have a machine down in Texas that actually, it's a robot that heats a wire up and bends the wire for us. So it's all done through the computer. We put in what we want for bends and it sends us the wire. One of the major things that I really noticed is we went from a 24-year treatment plan down to a 14-month treatment plan, or 24 months to 14 months. So it's a lot of, I mean, it's very come a long ways technology wise.
That's great. So tell me if there was ever a time you were really nervous about something that was happening. And then on the flip side, something that was fun, like a great day, but then maybe something scary that happened.
Yeah. I think when we incorporate something new, we only get like, you know, when you practice on, assistants will practice on each other to get used to things. But when that first patient comes in and you have to do it live, and you just have, you know, you're not quite sure how it's going to go. You're not quite sure if the software is going to work properly. So it's exciting to be the person that does that first procedure with the patient. But it's also nerve-wracking because you're kind of fumbling through it, trying to be like, okay, I got to find a system, an easy flow, but yet you're still trying to maintain that, yes, I got this, so the patient isn't nervous, like, what are you doing? So I would think that would be my most nerve-wracking point, is when we try new procedures in clinic and we're just kind of, it's not that easy flow. It's not every day what you are used to. It's kind of a hiccup in the system, but otherwise, most of my days are fun. One of the things that's also a little nerve-wracking is when you pick up the phone and answer the phone and you get a question that you're not quite sure about, because, I deal with a little bit of finances, but we have a financial coordinator that deals primarily with it. So, just answering questions and, just being on your game, top of your game and things like that.
So you talked about and showed us, that was awesome, some of the different types of devices and braces in general. Back, in the dark ages when I had braces, there was only traditional. How would you and an orthodontist make a decision to go traditional versus Invisalign?
A lot of times it's how your bite is, what can be handled, and how much movement needs to move the teeth into the straight position that we want them. If there's too much movement, Invisalign would obviously be out of the quotation. It would just be traditional. But we do have, we have the stainless steel traditional, and we also have ceramic, the clear braces. So we try to soften the blow. We can't offer you Invisalign, but we can offer you clear braces. Invisalign is a great company. It's a great product to have if you have minor adjustments. We're not much of a fan of having Invisalign used on kids, because just like retainers, it gets costly if you throw away your Invisaligns and you have to replace that. So doctor prefers to go the traditional method, but he still does offer that Invisalign in the background.